Hello, my name is Pedro and I'm one of the arrhythmia specialist nurses. I'm going to talk to you about permanent pacemakers, what they are, why you might need one, and what it's like living with a pacemaker. The heart is a complex structure that is responsible for pumping blood everywhere in the body. It contracts and relaxes in response to electrical signals that stimulate the heart cells. You can find more information on the BHF website. If you point your phone camera to the QR code in this slide, just click on the link that appears and open the web page. Heart cells are very special as they can start electrical signals, they can respond to these electrical signals by becoming excited, and they contract. They then transmit that same signal to the next cell, and this is how your heart will pump. The contraction squeezes the blood into circulation, and you feel this as your pulse. So the heart has 4 chambers. The 2 top chambers are called atriums, and the bottom chambers are called ventricles. The right top chamber has a small group of cells called SA node or sinus node. This group of cells are the natural pacemaker cells of your heart. They start the electrical impulses that then spread across the top chambers, making them contract and squeeze the blood into the ventricles. Still in the right atrium, but right in the middle of your heart, sits a very important junction box called AV node or atrioventricular node. This is a really important structure because it's the only electrical connection between the top and the bottom chambers of your heart. All signals must go through the AV node to reach the ventricles. Just after the AV node and connected to it, there are 2 major motorways called bundle of His. And the bundle of His takes the electrical signals to the right and to the left ventricles, spreading the signals through these and making them contract and squeeze the blood to the lungs and everywhere else in your body. It is probably easy to guess then that any failure, damage or disease to these structures will impair on the electricity flowing through the heart, and therefore they will impact on the heart rhythm and how the heart contracts. For example, if you have suffered a heart attack and any of these important structures has been deprived of blood and nutrients, this can affect their ability to conduct or generate electrical impulses, and you may need a pacemaker. You can find out more about your pulse if you scan the QR code in this slide. The normal heart rhythm is usually called sinus rhythm. But hearts can beat at different speeds, and we usually describe a slow pulse as bradycardia and a fast pulse as tachycardia. Not all bradycardia or tachycardia is dangerous. If there is an abnormality on the electrical pathways described in the previous slide, then this will affect the speed that a heart goes, and sometimes this can be worrisome. Not everyone that needs a pacemaker will have symptoms, but usually one can feel short of breath, fatigue, or even as far as having blackouts or feeling very close to blacking out. There are various causes for someone to need a pacemaker implanted. Some causes of the bradycardia, or slow pulse, can be due to wear and tear of the normal electrical pathways. The signals are simply transmitted very slowly, and the heart can't keep up with your level of activity, making you feel breathless, for example. If there is a disease of the electrical pathways, the signal can be blocked from spreading across the heart muscle. Sometimes, the top and bottom chambers can lose connection and beat out of sync. We call these heart blocks. Some patients require a pacemaker to improve the functioning of the heart and the amount of blood that gets squeezed from the bottom chambers. This is normally due to heart failure, and there are special types of pacemakers that can help in these cases. Other times, we need to control how fast the heart goes by giving you medication. Unfortunately, the same medication sometimes can make your heart go too slow, so we implant a pacemaker so we can give you more drugs to control how fast the heart goes without worrying about how slow the heart goes. This might be also referred as tachybrady syndrome. Pacemakers are small devices that can prevent or treat abnormally slow and irregular heart rhythms. They work by replacing the normal pacemaker cells of the body. A pacemaker is a very clever piece of equipment with very advanced technology. It detects your own heart rhythm and only intervenes if it fails to recognize electrical activity within the parameters that is set to. We call this working on demand. You can scan the QR code to find out more about how the pacemaker works. There are various types of pacemakers. Single lead pacemakers usually have a lead going into the right ventricle, but sometimes it can just be the right atrium. Dual chamber pacemakers are very common, and this can sense and deliver small impulses if they fail to recognize your own heart's electrical activity on the top and on the bottom chamber of your heart. Biventricular pacemakers are used when the heart function is lower than normal. They can be really helpful in patients with breathlessness as a result of poor heart function, but they are not suitable for everyone. They make the bottom chambers contract and squeeze the blood in synchrony, maximizing your heart function. They need to be given to patients alongside a good drug regime to be most effective. Micro pacemakers are the new thing in the market. They are very small and they are implanted from the top of your leg right into the inside of your heart, and so they have no leads. There are other very special type of pacemakers that can shock your heart if they detect a dangerous heart rhythm. These are called defibrillators. Defibrillators usually can also function as pacemakers, and they tend to be offered to patients that are at a higher risk of fast, dangerous heart rhythms that can lead to a cardiac arrest. There is another video that you can watch if you want to find more about this type of pacemakers. Pacemakers have two main components. There is a box or pulse generator and the leads. The box is where the battery is, and also there is a mini computer that stores information of your device and tells your device how to work. It also contains a battery. The pacemaker batteries tend to last for up to 10 years, but this depends on their usage. When the battery comes to the end of its life, we simply replace this box, and there is no need to do anything with the leads. The leads are the wires that transmit the electrical signals and deliver them to the heart muscle itself. They are robust and usually last for years and years without a need to be replaced. Sometimes they do need to be replaced, though, and if we see that there is an issue on their function and ability to conduct and read signals of your heart, we might propose this to you. Both the battery life and the health of the leads is something that is checked routinely, so we ensure that your device is suitable and is doing its job as it should. The pacemaker implant is relatively quick, and most cases it takes anything between 30 minutes to an hour. Sometimes it can take longer, and this doesn't necessarily mean that there is something bad or wrong going on. The majority of patients has local anesthetic to the area where the device sits, usually just below your left shoulder, and a sedative to ensure there is no pain and you feel relaxed during the operation. If you are coming in as an outpatient, then expect to be discharged about 6 hours after you have your device implanted, and this allows time for you to recover from the drugs we will give you and have the necessary post-operative checks. Usually, we can do these procedures simply as an outpatient, but in some patients we have to admit them to hospital and carry them as an inpatient if we think your risk is higher of any problems. If you are an outpatient, you are offered a preoperative assessment about a week to 2 weeks before being admitted. In this pre-op assessment, we will talk you through the procedure and put together a report of your needs so we make sure we can look after you appropriately whilst you are in the day case unit. If you are an inpatient, then you will be able to ask any questions to your medical team or nurse that is looking after you. During the procedure, your cardiologist will clean your skin with a special product to reduce the chance of infections. You are then covered with a big drape. They will inject local anesthetic just below your collarbone, which will numb the area. At the same time, they will give you some sedative, pain relief, and antibiotics to reduce the chances of any infections in the pocket that will create where the pacemaker will sit. A little cut on your skin is made, and the operator gets access to the blood vessels next to your collarbone so they can pass the pacemaker leads through the vein all the way into your heart. The pacemaker is then placed under your skin, and will be connected to the leads. Throughout the procedure, you are being monitored, and the team will make sure you are okay and pain-free, relaxed, and comfortable. You might overhear some of the conversation between the team, and mainly this will be numbers, which is just us making sure we are happy with the readings that we are receiving from your leads. Usually, we will close the skin with stitches, and these are normally dissolvable. We can also use glue or paper stitches. We usually cover everything with a plaster dressing to make sure we keep the wound clean and dry. This is very important because it makes sure that you don't develop any wound infections. With any heart procedures, there are some risks to consider. This will, however, outweigh the risks of not having the operation. This slide summarizes the risks, and you will have an opportunity to discuss this at length with the medical team before going ahead with your operation. There are other risks like pain over the device, and this might mean we need to move the pacemaker to a new place. Everybody also heals differently, and therefore some patients might have a scar. Some risks require us to recommend you to have additional procedures, and this will be something that we will discuss with you. If you are an outpatient, you will need someone to pick you up from hospital and to stay with you for the first 24 hours. Whilst the skin above the device should heal relatively quickly, it does take some time for you to get used to the new device, and you might find it uncomfortable for a few weeks whilst everything settles. Before going home, make sure you know what to expect, you know who to contact if you need any help, and what medications you should stop or start and when to do this. It is very important to look after your wound. You will be given a leaflet with written information about this. You should make sure the wound is clean and dry, and you should keep the dressing on if you have one. You should do this for 5 days. After day 5, peel the dressing off carefully. Expose the wound to air. If you have paper stitches, this will come out on their own, so don't peel them off. If you have any glue, also do not peel it off. It will come out on its own as well. Only after 7 days from the procedure should you get the wound wet. This helps preventing any infection from developing. It is also very important that you do not elevate your arm above the shoulder. This allows the lead to bed in properly and heal in the right position. Some movement is fine, and you can do any other tasks that don't involve lifting your arm without any problem. Doing so also stops you from getting a frozen shoulder. And in the next slides, one of our colleagues from the physiotherapy service will talk you through some exercises that you can do.
Hi, I'm Hannah. I'm one of the physiotherapists at the Bristol Heart Institute. This is a few slides and a short video to show you how to prevent your shoulder having problems after your pacemaker is inserted. After your pacemaker, you are allowed to move your arm freely within the limits of pain. On your affected arm, we advise avoiding movements that produce an extreme stretch of your arm, for example, reaching out in front of you or reaching out to the side. This is in order to help the leads of the pacemaker embed into your body, and we advise that you follow these restrictions for approximately 6 weeks. So other things to avoid are swimming or golf and pushing and pulling heavy weights. Whilst we want to protect your new pacemaker, it's also important not to let your shoulder become stiff and hard to move. Here are 4 exercises that you can do safely after your procedure. First exercise, the pendular exercise. Leaning onto a table with your good arm, letting your affected arm dangle forwards and in front of you. Using gentle movements of your body, let this arm swing forwards, backwards, side to side and in circles. The more you lean your body forwards, the more of a stretch your arm will have. Neck stretches. Start in a seated position, looking straight ahead. Look down towards the floor, moving your neck, and then look up towards the ceiling. Look over your right shoulder, and then look over your left shoulder. Move your right ear down to your right shoulder, and your left ear down to your left shoulder. Try to keep shoulders down and relaxed at all times, and hold each position for 10 seconds. Shoulder shrugs. Sitting down, roll your shoulders forwards and backwards 10 times each way. Shoulder external rotation. Keeping your elbow close to your body, gently rotate your arm out to the side and hold it there for 10 seconds. Repeat this 5 times. You can add in holding a walking stick or a broom to help with the stretch. You should aim to do these 3 times a day to prevent any problems developing. Recognising a shoulder problem. So these gentle exercises should be enough to prevent shoulder problems happening, but if you feel arm movements are getting harder or getting stiffer or more uncomfortable at your shoulder joint, you should go to your GP and seek a referral to physiotherapy at your local department. If there are any issues such as redness or infection or pins and needles, you should contact the EP department.
When you go home, remember you've had an operation and make sure you rest. Avoid doing strenuous exercise, carrying heavy things with the arm on the side of the pacemaker or against your chest. You should avoid contact sports going forwards. The device is quite robust, but you can damage the skin over it, which can lead to the need of other procedures and also increases the risk of any infections of the device. Remember to inform the DVLA and your insurance providers of the fact that you now have a pacemaker. The device can be very sensitive to magnets being around it, which is why you should let your healthcare team know if you have a pacemaker and if they are planning any procedure or interventions. This also includes having any dental work done. The vast majority of the appliances are safe to use, however you may wish to check this with a cardiac physiologist team. It is safe to use microwave and induction hobs, however do not get too close to this when they are in operation. You should also keep your phone away from the device. If going shopping, don't rest too close to the metal detectors at the exit and simply just go through them as normally, as this is unlikely to affect your device. When going through security at the airport, for example, just let them know you have a pacemaker. You will be given a pacemaker card and you must make sure you carry this with you because it contains valuable information about the maker of your device, the leads, and other important details. The new generation of pacemaker and their leads is compatible with MRI scanners, but you should check this regardless, and you must tell the team that you have a pacemaker. Your first check after the implant will be at 6 weeks to ensure that the settings and readings from the leads are as expected. We'll also check that the wound is healing and that you feel well. Please do not wait for this appointment if you think something is not quite right. You can contact us before then if you have any concerns. During the checking of the device, we will make sure that the leads are working fine and that the battery level is also okay. It is very much like having an MOT on the device. After this, you will have routine follow-up at least once a year. The cardiac physiologist team will let you know on your follow-up appointment if you need to be sooner than this and why. It is very important to know when to ask for help. And after the procedure, if you feel breathless, if you're not able to speak full sentences, if you have chest pain, if the wound is swollen and getting bigger as you look at it, or if it's bleeding or whipping, you should contact 999 or present to the nearest emergency department. If the wound is red, hot to touch, or swollen but not increasing in size, please get in touch with the arrhythmia nurses. For anything else, please contact your GP or NHS 111, who will be able to direct you to the best service. These 2 QR codes open a PDF document that is the pacemaker leaflets of the British Heart Foundation and the Arrhythmia Alliance. They are very good resources if you want to find out more about having a pacemaker and living with one. They have a lot more information about heart conditions on these websites, and you might find this very valuable. We are here to support you and troubleshoot if you have any problems at all. We do not replace urgent medical advice, and therefore you should always contact 111 or your GP or 999, depending on the degree of urgency of your concern. For any issues with your wound, you can contact the arrhythmia nurses team via the number on this slide. If you have any device issues or problems with remote monitor or for pacemaker follow-up appointments, please contact the pacemaker team. Thank you for listening and good luck.